On behalf of the USC Department of Urology, I want to welcome you to this Drive for Men's Health, which is the first time that it ends in Los Angeles, and the guys came all over, the country, from Florida, all over here. And thank you very much. So this is a very special occasion, and at the end of your trip you also brought together the second Tesla, the female breast cancer awareness Tesla. So I think this is a very good opportunity to make people aware that men's health and women's health are very important. Thank you very much, Dr. Parakatil and Dr. Bramla, for bringing this all together. I also want to thank Tesla Motors who brought the cars over here. And thank you, Mr. Ligon from the LA Chamber of Commerce for your support, and your continued support for our efforts. And of course, the local organizing committee, including the Trojan Marching Band, and very special thanks also to Joan McLean, who coordinated all this. So without further ado, I want to pass on to Mr. Ligon, who wants to say a couple words to us.
Trojans! Any Trojans in the house? There are a couple of Teslas out here that make this a very significant day, and the Chamber is excited about being a part of it. My name is Lee Liggins, and I'm the one of the vice presidents of the Los Angeles Area Chamber of Commerce. We've been around for 127 years, thankfully because of representation and support of great companies and institutions like the University of Southern California. Let's hear it for USC. And in fact, USC's Vice President of Public Relations will be the chair of the board in 2016. If you know Tom Sales, tell him I told about his upcoming presidency. And then bottom line, I'm happy to be here representing 675 companies who are very excited about the drive for men's health and also for breast cancer. And we thank you. I can't thank you enough for bringing the Florida idea to California. A great place to start, but a great place to finish as well. Congratulations on a wonderful, wonderful achievement. Puts a spotlight on things that are very important to all of us, men's health as well as breast cancer. So I thank you for the opportunity to be here, to welcome you to Los Angeles, and thank you so much for all the work that you're doing. Thank you. Have a great day.
So thank you, Seja and Janine, for including USC in your Drive for Men's Health. This is a very important cause, and more and more centers are developing men's health centers, and patients want these programs. So thank you for including us in this very important cause. I'm the Director of Male Fertility at USC. I work very closely with the internal medicine teams and also the reproductive gynecology teams. As a lot of people know, up to 50% of male factor infertility has a portion that is due to male factor, and USC is proud to offer a dedicated male fertility service, and we're excited to be involved in the management of these patients. So thank you for including us, and we look forward to future years. Thank you.
Thank you so much. First of all, a round of applause for these guys. What they did was fantastic. Second of all, a round of applause for Ms. Joan McLean, who helped organize this for our department. Welcome, Ms. Joan. Thank you all for coming. Leo Demoni, and I'm associate professor in the urology department. And my subspecialization deals a lot with erectile dysfunction. There's about 18 million men with erectile dysfunction out there. And erectile dysfunction is essentially a proxy for small vessel disease, which is found in the heart. So they've done a recent study where they showed men 45 years old and older without the diagnosis of heart disease, but with moderate to severe erectile dysfunction have up to a 50% chance higher likelihood of being admitted to a hospital for their heart condition. Therefore, I think we need to get out there and educate society about the relationship between erectile dysfunction and heart disease, because this is the first proxy. This is an indicator that our men, in order to stay healthy, we need to evaluate them for the erectile dysfunction and get them to the internist and the cardiologist. Thank you very much, guys. Have a great day.
Yeah, so clearly men's health is not just a urology thing. The urologist is central in management of urological disease for the male, but other specialties, cardiology, internal medicine, primary care, GI, and other specialties are involved as well. So our next speaker will be Dr. Taylor.
All right, my name is Greg Taylor. I'm the medical director of our Keck Medicine downtown LA. So my specialty is internal medicine, also geriatric medicine, so I always want to remind you all of the basics, the fundamentals of health, okay? We all know that the top 5 causes of death have to do with primarily preventable diseases, right? People that die from heart attack, they die from some cancers, which do have a large preventable component. We also know that they die from cerebral vascular disease, so that's cholesterol that may be depositing in your brain. So, what is the value proposition where healthcare is going? Okay, what does the future hold for healthcare? Providers and institutions that can help prevent disease are going to provide value in the future. Okay, that's where we're going. So, what does this mean from a primary care perspective? So that means when you go to your primary care doctor, if they're not talking about how can we prevent you from having a cardiovascular attack, then they're not doing you a disjustice. Okay, I just happened to have attend a lecture by Dr. Williams, who is the chief of the president of the American College of Cardiology. And what he said is that we've been all around in circles only to come back to realize that a plant-based diet can prevent cardiovascular disease. Okay, plant-based diet. So if your primary care doctor is not encouraging you to incorporate more vegetables in your diet, to decrease red meat, then they're not a part of the future. Okay, what else? If your primary care providers are not talking to you about resistance exercise, okay? It's not just good enough to have a strong heart. You have to have a strong skeleton. It's kind of like these cars right here, right? You have a nice fancy engine, you push on the gas, you turn on the motor, okay? You turn on the motor and you speed off 100 miles per hour and then the frame will fall apart. That's just like your body, okay? You have to have a strong skeleton, so resistance exercise is key. Don't forget that resistance exercise should cover your lower extremities, your core, as well as your upper extremities. Resistance exercise can be as simple as push-ups, planks, and squats, all the way up to fancy gym equipment. Okay? Don't forget that. Finally, I want to leave you with Keck Medicine downtown LA. We have a beautiful facility downtown. For those of you who like to hang out downtown, you Florida folks, come downtown and hang out with us. Come visit our facility. We have executive health. We have a whole range of services, not only for men, but for women. Thanks a lot and have a beautiful year.
As a recent patient of Norris Cancer Center, I was asked to say a few words about my experience and how I arrived at USC Keck. My experience with cancer has been, so far anyway, short and quick, just like a little inconvenience. And there's not that many people. Do I really need the mic? Yes, really need it.
It's being a webcast, so you're being
there you go.
Hundreds of thousands of people watching.
Millions.
I can really hold this speak.
Oh, that's all right. Yeah, great. Fortunately, I've been getting yearly executive physicals since I was 30 years old. I'm now 45. About 4 months ago, while I was doing my yearly physical with my concierge doctor, he noticed my PSA was high. It was between 6 and 7. We went back and checked my last physical, which was in Hong Kong, and noticed that it was still a little bit high at about 5. Hong Kong report had a one-line comment saying, "See your urologist." It was not enough for me to take note. and I wanted, and then I waited another year and a half for my physical. It should be noted that my insurance, a premier PPO, did not approve my initial MRI, even with a PSA of 6. I had a pay out of pocket, which I gladly did at the request of my doctor. The MRI showed growth, and then I had a biopsy. As it turned out, I had a Gleason 7, 3-4 prostate cancer. It was only through regular screening and a willingness to go out of pocket that I discovered I had an aggressive form of prostate cancer not typically found in a 45-year-old. Shortly after, Dr. Cosgrove's office lined up a consultation with Dr. Gill's office in Beverly Hills. This is where P.A. Park and Dr. Gill and I first met. It was immediately evident that they were highly competent and passionate. It took only one visit to schedule a time for surgery. I knew right away that I wanted Dr. Gill to be my surgeon, and I was glad I did. And I'm glad it's over. In less than 2 months of being diagnosed, I went in for surgery. It's now about 2 months since my prostatectomy, and I can say I'm healing up nicely with very little inconvenience. As a father of 2 children, one that is 7 days old, I'm thankful that we addressed the issue head on, and for now, eliminated the cancer. There was acute pain after for a few weeks. Then there was, some minor complications. But all of these pale in comparison to what could have been in case, I had not followed up my regular screening with prompt action. In contrast to my story is my father's story. 2 weeks ago, after a brain scan, an extremely large tumor was detected. 4 days ago, 75% of the tumor, which turned out to be cancerous, was removed. His prognosis is not what it would have been if he screened earlier and took action. His case is so recent that the family meeting and prognosis for treatment is next week. When health is concerned, there are 2 issues: quality of life and longevity. Both are greatly enhanced with regular screening, consultation with doctors, and decisive action by the patient. As tomorrow is Father's Day, I would like to wish all the fathers in the crowd a happy Father's Day, and please get screened. Thanks for letting me share my story.
Polytechnic University. So this is just a few words from Dr. Randy Evan.
Hey, Dr. Pericato, Dr. Brombach, congratulations on completing this year's drive for men's health. I know it was a very long drive, but you finally made it. Sorry I can't be there with LA to celebrate with you guys, but I'd like to thank you for supporting our students. The money you've helped raise will go towards scholarships and give our students opportunities to solve challenges in high-tech fields. For instance, our nanotechnology health informatics programs are advancing healthcare and the quality of life for us all. Doctors, your commitment to education, health, and community has really shown through at this important event. I also want to thank one of our students, King Raywall, for representing Florida Poly in this year's journey. Ben, it was great to have you involved as an ambassador for our university. What a unique experience to share with these 2 leaders in health and industry. It's been wonderful to follow the whole team across the country. I can't wait to see how you outdo yourselves next year. On behalf of everyone at Florida Polytechnic University, thank you and have a safe trip home.
And just one or two final words. We wanted to give a gift on behalf of the City of Claremont to the USC Department of Urology, because none of this would have been possible without the strong support and help from Dr. Fuchs and your department. And we called you last minute, and you guys really came together strong for us. And so hopefully this time we'll give you 1 year's notice. But really appreciate you being the local drivers, and that's really what matters. And hopefully we can make a change in men's health.
Well, thank you very much. And Joan, would you please come forward?
And this thing was wrapped really nicely in Claremont, but 6,000 miles, it's a little wear and tear, so sorry about that.
Okay,
Very much.
so I think this is something that is well deserved, and for your future, all the best, and for your father also all the best. I know where he had the surgery, and it's an excellent place, excellent surgery, so all the best.
Okay, thank you so much.
One final thank you. I just wanted to thank the crew behind the Drive for Men's Health. So if we could get the crew to come up here for a moment. We have the whole crew.
So while we're waiting for the crew, we want to let you guys
And
know.
Anne, if you could come over too, thank you very much for coordinating everything. So just there's a lot of people behind us that really do the hard work to get this all set up. Our urology clinic too, the Pure Clinic, if you guys could come up too. So we have an entire team or crew of people, and we'll just take a quick photo. But again, thank you so much for the whole team. Now we would like, should we do a group photo?
Well, we are going to do a group. We'd like to introduce our crew. We have Raj here, who's a student. We have Ben from Fuller Polytechnic. We have Dr. Kirk Hoddle, my co-driver.
We have Aaron Puneker, who came all the way from Michigan. I dragged him. He's a medical student there, and we kind of twisted his arm into taking a week off. Matt Hirsch, he's an engineering student from Virginia, and he is a biomed engineer, also applying to med school, and he did a lot of work with us with our high school robotics programs in the last few years, and so we managed to twist his arm into coming for a week with us. DJ Doc, Jonathan Prado, and he's amazing. He runs the entire AV crew here. All this AV setup, he runs ahead of us with his crew to set all the stages and everything, and it's been crazy, 10 days. Thank you so much, Anna. And your crew. Thanks, guys. Thank you very much.
And then we have Fred here, Fred Lopez Photo, who I am surprised he made it here. He cracked his camera right before today, but he's an awesome photographer, joined us for a good portion of the trip. We have our social media guru. So I want to tell you guys about social media. So our entire stop in Indianapolis planned for social media. Dr. Terrace here planned through social media. We've hit over 1 million impressions in just 10 days. And we've hit several million hits on media. If you look at, actually Jimmy Kimmel had a little piece on our Drive for Men's Health the other day as well. So we are definitely making an impact, and we would not be able to do it without his efforts and his team's efforts on social media.
Ben is from Skillful Antics. We wanted a shameless plug today, so we put that in. And we have Carl Regan.
Carl Regan, who's a physiotherapist, and he's actually my personal trainer. I know it doesn't look like it, but I have been going for 6 months playing this drive. But he's been providing multiple educational activities and education throughout the drive, even on our live webcast. So Carl, thank you for joining us on this.
So next year we promise we'll exercise a little more. I'm sure. And we have Anne. So Anne, thank you so much for setting everything up at USC, and I really appreciate she's single-handedly kind of organizing a lot of the efforts here, and we really appreciate it.
Thank you. And then we have Harry. Harry's behind the scenes quite a bit, even though he wants to be in front of the scenes, but he does a great job behind the scenes. And he's edited all the videos that you see. He's an amazing videographer. And without him, we would not be able to capture all the moments that we have. So Harry, thank you so much. All joking aside, you've been awesome.
We've been pretty rough on him, because every night when we go to bed, we tell him, okay, you need to get this video done.
So the video for today will be up in 4 hours, right?
And then our urology team, we have an entire staff back in Claremont, and 2 of our staff came out here. Brenda, our office manager, and Elena, our nurse, and really appreciate these guys allow us to run off and do these kind of things while they're taking care of our patients and keeping the home front safe. So they were kind enough to fly all the way out here, and really appreciate it. So thank you so much, guys.
And then we have Dr. Zula, who's our fellow right now, who will be taking the Career Clinic to Houston. Is that final, or am I going to announce it?
It's close to it. So Dr. Tjula was covering the floors for the week, and then we have another urologist covering us for this weekend. So we thought we need to give him a treat. A little break. A little break, so he flew up just for the weekend.
Yeah.
And again, I'd like to thank all of you guys for coming out, friends, family, supporters. We're giving you a heads up notice, June 18th next year, same place, same location, even bigger and better. So thank you so much, guys, but thank you so much for your support. We wouldn't be able to do this, and I want to thank my partner in crime, Dr. Brabant. I couldn't do this without him.
And I want to thank Sidro. Sidro definitely has a vision of collaboration, and that vision has really, I don't know, I'm getting emotional here. Really sweats out of him, and then everyone just kind of takes it and takes it.
This is what several hours of Katy Perry late at night does to me. So,
but I'm just happy to be his partner, but both of us are very happy that we have partners like USC and all the institutions that we stopped at. We stopped at over 70 stops. We had 17 major cities. We had 17 major university affiliations, and we're so happy that USC opened us with such open arms. So thank you so much. And men's health is definitely going to change. If you look at the statistics, as they mentioned up here, Men are in a state of crisis. We're living 5 years younger. 9 out of 10 top causes of death we actually die of. And we actually did a survey through Orlando Health, and we asked 2 simple questions. We asked 1,000 men, what was the make and model of your first car? And 81% of men were able to answer that question, whereas only half were able to tell us what their last doctor's appointment was. So we're hoping with affiliations like USC and partnerships like the Drive for Men's Health, we're able to change those statistics where next year we no longer have to do a drive, and the only thing that's left on the road is that pink car. So. Thank you so much, man.
You guys have the banners up! You guys have the banners up! Dude, that's awesome, man! I love you guys!
We got it.
Oh, dude, look at his chair!